Well, thank you all for joining us today. My name is Dr. Joanne Yanez, and I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges. With me today is Dr. Jaquel Patterson. She is a nationally recognized naturopathic physician, success coach, and best-selling author and sought-after speaker. She owns a successful multidisciplinary medical practice, including naturopathic medicine, nutrition, internal medicine, physical therapy, acupuncture, and more in Fairfield, Connecticut. She's got over 12 years of clinical experience with a focus predominantly on autoimmune conditions, Lyme disease, allergies, anxiety, depression, and childhood developmental disorders. She is also the immediate past president for the National Association, our National Association, the American Association of Naturopathic Physicians, and serves on the board of the Connecticut Association of Naturopathic Physicians. Dr. Jaquel is a sought-after speaker and presents at many conferences, including the World Conference for Anti-Aging Medicine and more. I am just so happy to have her here. There's so much more to her bio that I could go on and on and on, but I'm really excited to have you here today talking about autoimmune conditions. This is something that we hear a lot about. They are very insidious and really impact so many people, and folks who are working with and dealing with autoimmune conditions often don't feel like they have many options that look good. And so I would love to hear your story, hear how naturopathic doctors address autoimmune conditions. Just a reminder for the attendees here today, everybody is in listen only mode. If you have any questions during the course of today, please use the Q&A box, not the chat, but the Q&A, so that we can address any questions you have. And with that, I'm going to turn over the show to Dr. Jaquel and make my face go away. And I'm looking forward to listening as well. So thank you so much for joining us.
Thank you. Thank you so much, Dr. Yanez. I'm so honored to be able to present today for AANMC, and I'm going to discuss natural approaches to autoimmune conditions. And it is actually, autoimmune conditions is how I began my kind of foray into looking at integrative medicine. And I look forward to sharing my experience, because our experiences are everything we have. It's everything we have with the patients that we serve, why we are doing what we're doing. And then also, a lot of the people that are coming to see a naturopathic physician often see numerous doctors prior to coming and seeing us, because they do not feel like they have all the answers met, or they're looking for a root cause. And so that's one of the things I love the most when I learned about naturopathic medicine. And I'm excited today to talk about some natural approaches to autoimmune conditions. I'm going to present for about 30 to 40 minutes. I wanted to make sure I left plenty of time to answer just any questions after the presentation itself. And let's get started. Okay, so you already know my background. As Dr. Yanez said, I am very active in the profession. I'm the past president of the American Association for Naturopathic Physicians. I am a national presenter, often present throughout the country on different topics, particularly autoimmune conditions, as well as Lyme disease is another area of focus for me, and mental health by way of anxiety, depression, and ADHD. I'm also a Forbes contributor, Amazon bestseller ×3. So writing is also another thing that I've been more involved in the last few years. And my background in terms of outside of, those things I've been doing more recently, I received my undergraduate degree from Cornell University in applied economics and management. I initially went to Cornell as a plant science major. So Cornell is actually very well known for having tons of different degree types. I was interested in integrative medicine. Even at that age, there wasn't as much known at that time. I'm in my 40s, so really the only person that I had heard of really was Dr. Andrew Weil. I was interested in it, but I didn't really know what I could do with a plant science major, or if I went the conventional medical track, how I would be able to actually apply integrative medicine. And so I changed my degree while I was in college to applied economics and management. Did a lot by the way of basically business and was very involved in other realms in federally qualified health centers, behavioral health centers, leading operations and also integrated care initiatives throughout the state of Connecticut. So also outside of clinical work, doing a lot by way of the realm of policy and also healthcare operations. So the background, everything always comes together. I also have an MBA in healthcare management at Quinnipiac University. And so my background in business and which kind of just fell upon as a backup option actually came in really well in my ability to have an impact both locally in the state and then also nationally. And then I learned about naturopathic medicine actually my last 1 or 2 years of being in school. I worked for a couple of years in the basically in the food industry in marketing and business analytics, learned about naturopathic medicine, went back, took all the pre-medical requirements and went to school. So when I learned about it, I was like, this is exactly what I had been looking for. I just didn't know what it was called. I knew the other route just wasn't the best fit for me. And so I was really excited to learn about this, and it was exact matchup for what I wanted to do. So I think it's also important to like, what do you like to do outside of naturopathic medicine? One of my challenges is I actually enjoy working. And so working feels sometimes like a hobby for me, but I do have a lot of other hobbies. I try to mix work with traveling. I like to travel a lot, spas, running. I am pretty active exercise-wise, kickboxing, boxing, spinning, dancing, hanging out with my partner and dog who's right next to me. Hopefully she'll be quiet during the visit, but she's a pretty big girl, 105 pounds. And like I said, my hobby is also work. So it's great to be able to work in my passion every day and to be able to do something that I love, that I've had a passion for since I was a kid. So I want to go through first, I talked a little bit about my background, how I got into naturopathic medicine, but I did want to go through also my story of how I kind of opened up my world to autoimmune conditions and naturopathic medicine at large. I want to then go through a review of autoimmune conditions and the prevalence in the society. And then I wanted to also show some patient cases. Okay, so my family story. So when I was around 15 years of age, my mother became really, really sick. She went through probably about 7 or 8 doctors. Where I grew up in New Jersey, it was kind of out in the middle of nowhere. There was not such great access to specialists and really doctors that would be in terms of the care that she really needed to get to be able to get fully worked up and her needs met. And so over a period of basically around 6 months, my mother started just progressively going downhill, just a lot of fatigue. We would be outside in the sun, and because we all played sports, there's 5 of us, and she would feel really horrible, really sick after she came out. She had a butterfly rash, a lot of fatigue, inability to move. It just kind of went downhill fast, and she lost a lot of weight to the point where she was down to around like 80 pounds. And my dad would actually have to physically lift her to go up and down the stairs. And that was before they could actually come up with a diagnosis. They didn't really know what was going on. So she finally got connected into the right care and was found and diagnosed with lupus. So she was diagnosed with SLE, a lupus, which really affects many different organ systems. It's called systemic lupus erythematosus. So it affected her joints, it affected her kidneys, it affected eventually like neurological system with seizures, it affected cardiovascular system. So she officially got worked up, she got put on medications, and she was sick for a period of time. So in many ways, for that good year of my life, I was my mother's nurse, and I got to see firsthand the experience of being a caretaker for not only her and also my siblings, but also understanding the story of somebody that's dealing with autoimmune conditions, because there would be some days that she'd be really great, and then the other days when things were in remission, and other days when she wasn't well. And so one of the biggest pieces for me during that time that I felt that there was really a lack of that interconnection with care, the fact that she went to, 9 doctors before she got worked up, the fact that she was seeing still after a time, all these different specialists, and continues to see a lot of different specialists with a lot of specialists, but there seemed to be like that lack of coordination of care, and also just working on things of why it started in the first place. When she got sick, there was just a lot of family stress at that time. And what you'll see with autoimmune conditions is it's often triggered by some initial stressor or something that predated it a couple years. And so that wasn't ever part of the discussion. And so me looking as an outsider, I really became disillusioned from that experience with the medical system and how I would fit into that model if I was interested in medicine. And so I just felt like as a whole, that coordination needed to be better, why it happened, what we were doing for lifestyle, what we were doing for stress management, what we were doing for diet, what we were doing for like that mind-body connection was just not part of that discussion. And so, so not only does my mother have lupus, but she also had rheumatoid arthritis, several different autoimmune conditions, my aunt as well, and my grandmother. So definitely on that side of the family, a lot of autoimmune conditions, and also even myself having some markers, but again, there's a genetic component to it, which we're going to talk about it. But that was really how I started getting interested in autoimmune conditions, just from that experience. And what you'll see with a lot of naturopathic doctors, many of us get into this field because of some story. It might not be our personal story, it could be a family member story, or it could be just a patient story as we're working with patients and we're seeing these changes and these experiences or these stories that are really similar. So that is how I first began my story in autoimmune conditions at the age of 15 years old. So if you look at autoimmune conditions as a whole, there's actually over 80 different autoimmune condition types, and it's more prevalent in women. So they do believe that there is a hormonal component. And I often will see that with patients where when they go through menopause or perimenopause, a lot of their symptoms might be flared more significantly. I'll see things that, especially like thyroid conditions like Hashimoto's, autoimmune thyroiditis, Graves' disease, et cetera, you'll see oftentimes after a baby, after, in ages when they're fertile, oftentimes where these kind of life changes of hormone fluctuations. So women are more likely to have autoimmune conditions than men. Again, over 80 different autoimmune condition types, many pieces, including genetic factors as a risk factor, environmental factors. There are definitely connections to different environmental influences, environmental exposures that you want to look at as a naturopathic physician, and actually physician in general, because there are tons of connections to that as it relates to autoimmunity and past infections. So infections, and we're going to talk a little bit about that, but that's been growing in more notoriety about how infections are actually related up to autoimmune conditions, and how many people with autoimmune conditions often had 1 or 2 infections that predated it. So for example, with lupus, one of the most common ones is Epstein-Barr. And actually, in fact, conditions like Hashimoto's, over 80% of people with Hashimoto's have shown to have the EBV, which is Epstein-Barr virus, EBNA positive, both, as well. And if you actually check the titers. So I'm often, when I'm looking at seeing patients, I'm looking at their autoimmune conditions, but I'm also looking at other infections, and I'll see some connections. When they get sick, the condition will be maybe more aggravated, or sometimes when I work with infections, like Lyme disease is an area of focus for us, I'll see sometimes the autoimmune conditions will get better. I just had a case like that today, which I'll talk a little bit about it in the case study today, even though it's not here on the list, but working on her infection actually got her markers in terms of her antibody markers down pretty significantly. So there is a connection up, and the reason is for many different mechanisms. One includes the fact of something called molecular mimicry, where these infections look similar to the autoimmune condition, and your body thinks it's that, and it turns on and activates itself to, start this kind of cascade of inflammatory response. The most common autoimmune conditions, when you look at, again, we have over 80. The most common ones are rheumatoid arthritis. Lupus is another one, type 1 diabetes, which has also grown after COVID. There has been a connection with that already in studies. Psoriasis and psoriatic arthritis, as well as MS, which is multiple sclerosis. So I already talked about some of the initiating factors of illness. So genetics, stress is a huge component. I don't think we always pay respect to stress as much as we should, but you'll see with a lot of illnesses, there is this connection to chronic stress or something, a significant stressor happening within a certain time period before getting their illness. So when you look at stress actually increases up a lot of inflammatory markers in your system, which causes inflammation, which can cause, can then lead to aggravation of an illness, a chronic disease illness. Hormones, as I mentioned, infections and environmental exposures, have been studies on things like lead and its connection, as well as mercury and autoimmunity. So the pieces you want to look at is when you're approaching autoimmune conditions, many different ways to look at it. The first thing I like to do is start with the basic of lifestyle modification. So naturopathic doctors, one of our tenets is prevention and also treat the whole person. So we really want to make sure when when I'm working with somebody with autoimmune conditions, or if you have an autoimmune condition, that you're approaching all those pieces to care. So the lifestyle modification, I always tell patients, I try to work initially with that, but at the end of the day, like ultimately that's what's going to hold you in the long run. So I will, work on it, and I might be giving you based on tests, et cetera, like supplements, herbs, et cetera. And I might go with a heavy hand. For me personally, everybody has their own style in the beginning, for the first few months. And then I start tapering down. And my biggest focus as we're transitioning off is, how do we keep your immune system stable? How do we keep your stress managed? And for a woman, how do we keep your hormones stable? Those three things are my primary areas of focus as I'm getting a person into like stability, and to maintain that stability, so they're not needing to be on, a million different things to actually maintain their condition type. I mean, oftentimes people do have to be on some things, but ultimately what's going to prevent those flares is really all of these modifications. So stress component is a big thing. I try to work with patients on what I say is what brings you joy. Not for everybody is meditation or prayer or spirit, people have spiritual practices, but what actually brings you joy, and how do we incorporate that every single day into your life? Diet, there are many different diet types. One of the common ones I'll look at for autoimmune conditions is something called autoimmune paleo diet. I don't necessarily hold that. They also call it AIP diet for a long period of time, but at least for a short period of time, to basically decrease some of those foods that are what we call pro-inflammatory. Because when you look at someone with autoimmune condition, the biggest piece is you need a balance pro-inflammatory versus anti-inflammatory. And most of us are more in a pro-inflammatory state, especially someone with autoimmune condition. So making sure the foods that you're consuming are less inflammatory is very important. So oftentimes looking at that, looking at food testing to see if there are specific foods that are aggravating them that need to be removed from the diet, not necessarily forever, but for a period of time. Movement is really important. I'm very into movement. And it doesn't mean that you have to be running a marathon. It doesn't mean you have to be kickboxing or doing CrossFit. It could just mean something as simple as walking. If you look at a lot of studies, the one things they find that is just as effective as those intense exercises are really walking, 30 minutes a day. So I try to get people, the movement is important, because once you stop moving, everything really doesn't come in line with that after. So movement is hugely important, even if I have a patient that's older, or it's harder for them to move, or they're sitting in the chair. How do we do exercises through the chair, or we get them to even walk a block or so, or build up from that? And then that mind-body connection, looking at how particular parts of our body might hold. There's a book called Our Body Speaks Our Mind. Are there places that you're tending to hold pain and inflammation more than others? And oftentimes you'll see that over a period of time. So lifestyle modification is the first thing. Immune modulation and regulation. So the other thing is, it is good to work with decreasing inflammation, and there's a lot of support naturopathic doctors can do by way of decreasing inflammation. But over time, you really want it to be so that you don't have to decrease inflammation, that the system is just balanced evenly, that it's modulated. And so initially, of course, when somebody's in a lot of pain, or there's a lot of musculoskeletal pain, joint pain, muscle pain, et cetera, we need to decrease that. But then over time, we want to see, how do we get the body to react normally? Like, how do we get the body, when it's inflamed, it's not overreacting or over responding, or it's responding the exact amount? We do need a certain level of our body to actually create inflammation, because when we do get inflammation, your body comes in and tries to heal it. So you need to do it. The problem is if it's chronic, if there's this chronic persistence of inflammation over time. Also decreasing the hyperactive response again, and that hyperactive response of how do we keep it at a normal level of reactivity. The other piece, which you'll see a lot in autoimmune conditions, is gut health. So a lot of naturopathic doctors, you'll hear often everything starts with the gut, and that is really important. And especially when we do an intake, our intakes are a lot longer. I might spend like 90 minutes with the patient, at least an hour with the patient, 90 minutes to 2 hours sometimes. And you'll often see this kind of pattern historically, especially with someone with autoimmune conditions, where they've had kind of these series of food allergies, or as a child, they may have had like a lot of ear infections, or were sick often, or put on antibiotics, or things, or maybe not breastfed or C-section, which is fine. But oftentimes, if you're not doing like probiotics and things to restore back those bacteria that are good, you already come in at like, you're already at a deficit. So a lot of times we have to first work on the core. And what you'll see in a lot of studies shows people with autoimmune conditions, over half of them will have some type of food sensitivity, or what they call allergy, IgE allergy, and will often have what we call leaky gut. And so leaky gut, but that means is there's this permeability issue, where there's the lining of the gut is there's some weakness in it, and things are going in and out and are not fully, absorbed, and you're not getting all the nutrients you need. But it can also cause a lot of abdominal pain, bloating, irregularities in stools. And so all of those symptoms, if someone is expressing those things that they have, we might need to test for that so that we can support. And oftentimes when you look to support the gut, you'll see some of these symptoms of autoimmune conditions get better. And there's been tons of studies that for autoimmune conditions, there's often a lack of particular, what they call lactobacillus. So lactobacillus is in things like yogurt and other fermented foods, and you'll often see in just some base core probiotics. But oftentimes people with autoimmune conditions are deficient in very specific lactobacillus strain, or they just don't have enough of that, as well as bifidobacterium. So we try to increase those up to just help to restore that gut flora and that gut balance. So this is just an example of a patient case here. And so we had a new diagnosis of rheumatoid arthritis. And she came into the office where she had actually been on steroids. So she was placed on Celebrex and prednisone, and she had 75% improvement. So that was great for her. She had 75% improvement. And she also had a prior history of ulcerative colitis. And so when she came in, she expressed, she had migratory pain that was moving throughout other areas of the body, fatigue. She had a positive ANA. So ANA is anti-nuclear antibody and rheumatoid factor. And those are two markers for autoimmune conditions. ANA is often looked at for rheumatoid arthritis, lupus, and also scleroderma and other autoimmune conditions, but more particular sometimes for other ones, but it's a little bit still general versus like rheumatoid factor, 14-3-3 NADA. So there are specific ones that might be a little bit more specific for rheumatoid arthritis, but she was positive for those too. And so what happened with her was she attempted to get off steroids, but she had a significant negative reaction. So she had like a crash and burn. So she got off, she felt great, 75% improvement. She gets off of it and she crashed. And so she was placed back on steroids. And so that's how she came to me. And you'll see that often when a person comes and sees a naturopathic doctor, they may have done another approach. It didn't maybe work as well for them. And so they're coming to us to see another solution, because obviously for her, she didn't want to be on steroids for a long period of time, because as we know, or any doctor knows, long-term use of steroids could be problematic for somebody. So I met with her on the first visit. We completed lab work. Based on her symptoms, she had migratory pain, headache. She had kind of some undulating fevers, which you can get you usually get more with other autoimmune condition types, but she had things that were very much in line with Lyme disease. And so I tested her, completed a blood work, did a panel, she was very active too outside in terms of the outdoors. So I did a whole panel, including, again, repeating rheumatoid factor, including ANA again, checking for inflammatory markers. So CRP is an inflammatory marker, and ESR. So CRP is one of the first ones that goes up with inflammation, and then ESR follows behind that. Mycoplasma and EBV. So I wanted to check for other infections and viruses, which I mentioned are often connected with autoimmune conditions because she wasn't feeling well. So based on those tests, I just want to make sure I put it. Yep. She was positive for Lyme disease, walking pneumonia, which she had in the past, and her ANA was also positive. So based on the energy level, I did actually initially put her on something called adrenal cortex fraction, which is a glandular. And the reason I put her on that was because of the steroids. So what I did was, she was on the steroids. I helped by giving her some adrenal cortex fraction to support the adrenal gland, so that when she tapered off the prednisone, she had a better response. She didn't have that crash. So, and then we eventually tapered her off the adrenal cortex, but I basically put her on that as she tapered, as well as B vitamins, because B vitamins like B5, B6, B12, magnesium, vitamin C, ashwagandha. This was a combination complex. All of those actually support the adrenal gland, and they're what they call cofactors. So B5, B6, B12, magnesium, vitamin C, they actually are like nutrients specifically for the adrenal gland. So I knew she needed support for that, because the steroids are working particularly with the adrenal gland. And I knew that could have been where some of the holdup was. So I gave her support around that. Also put her on Boswellia, which is an herb, which is a natural anti-inflammatory that blocks what's called the LOX pathway, lipoxygenase pathway, an inflammatory pathway. I put her on that. And then I also put her on collagen support. So I did put her on some things before the test came back, because I wanted to be able to support her on that prednisone tapering before, I saw her the next time. So she reported she was doing well. She was off the steroids for a week. She didn't have a crash. The swelling in her hands significantly reduced. So she had a lot of edema, a lot of swelling in her hands. That was significantly reduced. No migratory pain in hands and shoulders, and her energy was better. So she basically, like I said, tested positive for Lyme disease. And so I put her on some herbs, particularly for Lyme disease, that are heavily studied. 2 of them have been studied actually at University of New Haven and shown to be as effective, if not more, than doxycycline. And the reason I like this protocol in particular is there also includes things for autoimmune conditions like rheumatoid arthritis, and also for immune modulation. So these were the herbs that I listed here. Artemisia and Andrographis are really 2 of the highest studied ones, particularly for Lyme disease, but Artemisia as well, heavily studied for autoimmune conditions, and also serrapeptidase. So in her subsequent visits, her GI functioning was good, no flares over the course of the year. She did have a flare, and this was actually a good example of how stress can really impact your health. She was good, managed well, hadn't seen her as frequently. And then all of a sudden, a year later, after working with her, she came in and she just had a bad flare, and she was really nervous because she started feeling like, oh my gosh, this is what it was like the year before when I saw you. And what she didn't tell me initially at first was that she did lose her father. So her father passed away. She was one of the primary caretakers for her father. And even though rationally her father was older, she understood and knew that he was sick. It had been a long time, and that he was passing away. She realized that she didn't, I guess, kind of she didn't really mull it over, because she was a kind of person, and I'll see that a lot with the autoimmune personality, just keeps going. And she wasn't really reflective internally of how that could have impacted her health status. So her and I talked, and I said, I think we need to set you up with a therapist. And this is, again, where we're looking at the whole person, right? And so we do lifestyle counseling and are trained in that as naturopathic doctors. However, I often will work with other provider types because you really want to make sure that all of their care needs are met. So she went to a therapist, and I kid you not, after she went on one visit, and she's like, I don't, it feels like this is in my head. But after she went on one visit with the therapist, she like all of her pain went away. So swelling and migratory pain was no longer present. That flare that she had in that one situation completely went away. And she also, it was actually really good for her because she gained an appreciation for basically that mind-body connection that we talked about, and the importance of kind of checking in on how you feel about things. And so it was a reminder to her of like how, and also how she could incorporate self-care daily. So we have that. That one was one great case. And then another case, just because we're here talking about cases, a great case I had today, a patient I've been working with for 4 months, history of Lyme disease for 20 years, ran a whole bunch of blood work, and it looked to me like an autoimmune condition by way of lupus. Her titers were really high. Her ANA was 1/1280. So I just showed you this one here, which was 160. So imagine 1280 is high. That's, you know, about 6 times higher than this number. And so I set her up to see a rheumatologist so we could get a full workup, again, because her markers were so high. But unfortunately, a lot of times with specialty care or just with referrals, she couldn't get into care for about 4 months, 3 or 4 months. So we had basically 3 months we're working on. She's like, let's just go really hard on working on, you know, on my infection, as well as working on autoimmune conditions. And we decided, let's retest. So I had seen her, again, it's been around 4 months. First found that out about 3 months ago. We repeated the blood work recently after putting on a protocol, and her number went from 1280 to 160. So pretty significant drop. Her symptoms are a lot better. She's moving around better. She's moving well, but just in that short period of time, having seeing those markers actually drop down by way of integrative medicine and those changes before she even gets to see the rheumatologist. So it's been really awesome to see those changes in numbers, especially when you're able to see it progress in such a short time, and in somebody that was also older and had dealt with illness for a period of time. So what I want to say is what do I love about naturopathic medicine? What I love about naturopathic medicine is seeing those stories, that case that I just meant, these cases that I just mentioned, because that patient was so happy because she's like, oh, I might not need to be on medication. Sometimes it is warranted, but anything we can do by way of having it lessened or being able to prevent that onset is really everything. So I feel like when I get to see my patients, feel better, do better, and actually see the changes, not just clinically, but actually see the changes in laboratory testing, that really shows the proof in the pudding, is when we're working on the root cause and working on, why we can actually really get somebody better. So that's what I love about naturopathic medicine, that we're focused on the root cause of medicine. We also always ask why. We're constantly detectives of why. And that's one of the things when you come to see a naturopathic doctor, we're going to ask a ton of questions. And the reason is because we're trying to really figure out what is that point, where things change or deviated, or, what is the true reason that's kind of triggering everything else that's going on. And then again, being part of someone's long-term healing journey and empowering them with the tools to live a fulfilled, healthy life. I love being able to kind of finish working with a person where, we're really just working on lifestyle, we're working on stress management, who might be working on management of if it's a woman, like their hormones, cycle, etc. And they just really feel empowered. And I love to see people like they're now back and active exercising, or they're more socially active, and things that they really limited by way of their quality of life has changed. And so to be able to help to be just part of that journey to change that trajectory is really everything for me. So what am I looking forward to? So personally, what I'm looking forward to is really excited to my future plans. And actually now we just had our resident, our first resident, which is the first resident I've had, joined our office. And so I'm continuing to expand our practice, our site locations, to be able to provide this type of care to more patients at large, and really excited to have a resident, because it's the first time for us to have a student and be able to kind of support them in their journey, and not just with our patients, but also with the new doctor and new graduate. And I guess what I would say, I wish I knew as a student that every experience you have along the way is helpful in your future career. So I think that even the experiences I have now I always say that that can change tomorrow. Like tomorrow I could decide I'm going to do something completely different, and that's okay, because I know every single experience I've had to date has helped me for that new path I've done. And that's probably why I do so many different things, because I'm always challenging myself to do something different. Or maybe, I don't know, maybe I get bored fast, but I'm always finding something new to learn. I'm constantly a perpetual student. And I find that a lot with a lot of my peers. We're always seeking knowledge, seeking something, something to be able to add to our repertoire of what we can actually offer to our patients. But I think at that time, you know, being a student, having my degree in business, I was so confused because, again, I said I was a plant science major. I was in a program actually in high school. I have many cousins that are conventional, you know, MDs, to actually go through to medical school without the MCAT. And I didn't want to do that. And so I was told, like, what are you doing? What are you going into? This doesn't exist. And I went to something that I was like, okay, I like this a little bit, but I didn't know what I wanted to do. And then to see, you know, after learning about naturopathic medicine and having it all come full circle, to be able to apply even some of my business experience by way of leadership in the profession, or some of the influences I've been able to do in larger healthcare settings, it really all came together in one circle. So oftentimes you don't see it while you're going through it. But when you look back, I feel like my cycle, my path grows, like literally what I could do in a month, you know, what I would have been able to do a year, I can do in a month by way of activity, because you just keep getting better and better. And so those experiences build on each other. And I think when as a student, I didn't really understand that. And I didn't know how I learned, looking back, all those experiences, appreciating that, and trying to take really win in whatever place you're in that very second, is really the most important thing in life, because they all build upon each other. So this is okay. So this is just my contact information to follow me. I'm pretty active on Instagram by way of posts. So at naturopathic.physician, would love for you guys to follow me there. This is just the email this is a general email for our office, info@Fairfield Family Health. And this is my practice website, fairfieldfamilyhealth.com. So we practice out of Fairfield, Connecticut. About 40% of our patients are actually out of state. A lot of people come from Massachusetts or New York or New Jersey to see us. And because of our specialty care, and we have several different providers, including a nurse practitioner that helps to provide care for like primary care needs that our patients have, as well as things like acupuncture and cranial sacral therapy. So I'm so glad that I was able to share a little bit about my journey, my story, my experience of getting into autoimmune conditions, my mother's story, and then also just to teach a little bit about autoimmune conditions. I know it was very brief and there's so much more to go into as it pertains to autoimmune conditions, but I am glad that I was able to provide the information I could while I was here. And now I'll be open to questions. Thank you.
Thank you so much, Dr. Patterson. Would you just go to the next slide before we get started on Q&A? It had the events.
Oh, I'm sorry.
That's okay. So while Dr. Patterson is putting that up, oh, there we go. Perfect. So the next couple of events that we have through AANMC, we are hosting Naturopathic Residency Week. This is more geared toward current students. However, if you are interested potentially in the future in going into residencies, there's a lot of information here for you. And then we have our biannual Naturopathic Virtual Fair that's November 16th. And so we'd love to have you there if you have more questions about how do you make this your reality and how do you follow a path like Dr. Patterson? So the following slide has AANMC contact information if you have any additional questions for us after today's event. But with that, I will go through just some questions that we have here for Dr. Patterson. So there was just one, if you could either put in the chat or the book that you spoke, Our Body Speaks Our Mind, and who the author was, just so folks could find that.
Yep. So I'll look that up and then post it, because I just want to make sure I have the right exact title. Okay.
So there were a number of questions about Epstein-Barr. As opposed to Lyme, EBV can present with no symptoms or symptoms that mirror other issues. And so part one of the question was, how do you identify that something truly is Epstein-Barr? And then if you do, what is the course of action?
So it's interesting because I hope I have the title right too, so I'll check it. So it's interesting because I get asked that a lot from docs, that priest, because what happens is oftentimes people have more than one infection. They might have that, they might have walking pneumonia. So I kind of go through the clinical history of things. So if somebody has especially, let's say I'm seeing a younger person and they say things haven't been well since I was 19 and I had mono, and this happened at that time. And what I do is I test. So there's 4 different tests to do for Epstein-Barr. It's called Epstein-Barr virus. There's what's called IgM, IgG, and then another one that I will mostly check is something called early antigen. And so early antigen is great because it shows if it's actively impacting you now. So I found a lot of people, for example, like that had COVID, that had long haulers, that EBV early antigen was activated. Like they're like, oh, I had EBV when I was a kid, and it was no longer like, they thought, obviously wasn't positive, but then it kind of got turned back on. So I look at the early antigen to see if those titer counts are really high, to see how much is impacting them. And then usually the common symptom is just like a lot of fatigue. So I'm looking at that. I'm looking obviously at the autoimmune markers and any other infections, but also if it's the timing in comparison to other pieces that are going on. Oh, I can't hear you.
Thank you. I just realized I was muted. So there are a number of other questions coming in. One is about aloe vera and gut health. I don't know if that's something that you utilize or have experience with. If you do, feel free to chime in.
So I do use sometimes a small amount of aloe vera that's often in combinations. However, it is a cantharic like laxative. So what that means, it can irritates actually the lining of the gut to make you go to the bathroom. So I'm mindful of putting somebody on that for a long period of time. And I'll often see that actually with a lot of patients that come in, they'll be on, let's say like activated charcoal or bentonite clay or these things to help pull out of your system, or senna. That's a common one, the slimming, or what they call smooth move tea. And when you look at things like smooth move tea, they actually irritate the lining of the gut so you can go to the bathroom. So the part that I have a concern with that is that your body should naturally be doing it through getting like good food, good fiber, et cetera. And if you're needing to have something to kind of force you to go, you just have to question, like, why is that actually happening? And so what I have happen sometimes when people take those things for too long, they then can't go to the bathroom normally unless they take it. And so that's when I get concerned, is if you have to take that in order to go to the bathroom. So I usually do more gentle things like magnesium instead. Most people are magnesium deficient. I look to try to get fiber in their diet or their food things. And then I might do those things if I'm doing a certain protocol for a few weeks of time, but I don't like to do those for a long period of time.
Thank you. Could you speak about the relationship of psoriasis as an inflammatory disease and, anything as far as autoimmunity and the flare-ups?
Yeah, sure. So psoriasis, I have that, and psoriatic arthritis for a lot of patients, and it is autoimmune related. And oftentimes I find you'll see most naturopathic doctors will say a lot of things that appear on the skin, including things like eczema, often go back to the gut. So almost every single one of my patients with any kind of skin manifestations, I have to work on not only strengthening up the tissue, like the skin, through certain nutrients, vitamins like vitamin A, et cetera, but it's usually a huge focus on gut health. And so some of the foods I often see, not for everybody, that will aggravate the skin, like eggs and dairy, and sometimes gluten, things that are, those are a little bit more pro-inflammatory. Things like eggs and dairy are more mucus producing. And so you'll see that often more in the skin, but this is where testing comes in. So there's a saying like guess, or don't guess, test, right? So we want to make sure we're not kind of just guessing and removing things without actually knowing if that's really an issue for you. But gut health is like huge, specific for things that reflect on the outside of the skin.
Thank you. There are a number of questions. One that I'm going to kind of skip ahead to has to do with drug herb and drug nutrient interactions, and how can you ensure that the botanicals or treatments that you're giving may not interact with things like methotrexate or any other medications a patient may be on?
Well, there's a lot of online like software systems and resources where we can check for that. But as naturopathic doctors, we are like kind of the experts in drug herb interaction. So I think that's also where we stand apart, or we're different in that we know that's part of our training in school, is knowing how they interact, because we not only get trained in the herbs, but we also have a specific amount of training, at least 2 semesters in pharmaceuticals. So that's where we learned that. But there are obviously those systems, just like with conventional doctors with MDs, those things always get updated. So they have things like up to date, and there's a lot of resources where we can keep accessing when we recommend, to make sure that there's no contraindication.
Thank you. So there are a couple questions about nutrition. There are so many different, and I know you discussed one nutrition protocol that you tend to use with these folks. A lot of, back and forth about alkaline diets and various different types of nutritional protocols, anti-inflammatory diets, alkalinism, vegetarian versus carnivore versus, that so many, how do you help? I think more importantly, how do you figure out which diet is appropriate for the patient?
So I honestly, I kind of approach it like trying to meet people where they're at too. So if I have somebody that's like younger and has a standard American diet and is very not comfortable with making too many changes or picky, I'm really going to start with, okay, what do we first reduce that's like bad? So I'm going to first work on those things. If I have someone that is very hypersensitive to many different foods, that's where I'm going to say, okay, we need to do more testing to find out like what's going on with their gut health, et cetera. But I'm really looking at things that are decreasing inflammation. How do we incorporate things that are more like what they call omega-3s, rather than omega-6s, which are things like red meat, et cetera, that are more pro-inflammatory. I try to be mindful. I'm a little different in having too many restrictions, because again, my focus is like, I want people well now, but like, how are they going to be 20 years from now? I don't want to put people on these restrictive programs that they're going to be on for the next 30 years of their life. So I try to be realistic within that. Alkaline diet is one that comes up a lot. Usually I've seen it with alkaline diets, if they're more focused on the inflammation, I'm supportive of it, but we have to think in our body, we have different pHs for different things. If you look at like your gut, or your vaginal flora, for example, your pH needs to be like a lower pH than in other parts of your body. Your stomach acid for your stomach, your pH has to be much lower in order to break down food. So our body, it really needs to have these different pHs. And so you don't want to be too alkaline as well. And so there's the balance with that. So I really focus on that. Like how do we reduce the burden of inflammation first, but also looking at where people are at and how do we make like progressive small changes that can be more long lasting rather than short acting.
I know you mentioned during the course of your talk that a good number of your patients start to show up with autoimmune conditions after perimenopause, menopause. There are a couple of questions that have come in. One, perimenopause, one, somebody who after a miscarriage started to have different types of autoimmune symptoms show up. What is that relationship that you've seen between hormones and the endocrine system? And obviously the endocrine system is connected to hormones, but especially those female hormones.
Yeah, sure. So if you look at hormones, well, it's kind of like a triangle where it's like hormones, adrenal glands, and your endocrine system, your thyroid all together. So if you have chronic stress for a long time, like chronic output of cortisol actually suppresses the thyroid hormone. And so if you chronic stress, if you're suppressing the thyroid hormone, that's where you go into things like hypothyroid, et cetera. Also, as I mentioned, cortisol can increase up pro-inflammatory cytokines like interleukin-6. These things that all create this chronic inflammation, which will kind of allow for, again, with autoimmune conditions, this overactive immune system. So you're having both of those happen at the same time. So it's that suppression of the thyroid hormone. Then also, if your body's under a lot of stress, there's something what they call in naturopathic or functional medicine too, in naturopathic medicine, they call the cortisol steal. And so what your body will start focusing on the cortisol, and then it stops producing like DHEA, which helps with the precursor of things like progesterone and estrogen and some of these other hormones. And it really shuttles all of that to your stress response. And so all of those other things start shutting down, like your hormones don't work as well. There starts being inconsistencies in the cycle. And because your body is supporting that piece. So they're all really interconnected. And we don't oftentimes in the conventional model talk about that connection. We think of ourselves in all these separate buckets, but they definitely work to kind of support each other when the other one is weaker or needs more help, basically.
So we only have time for a couple more questions here, folks. Sorry about that. So Dr. Jaquel, there are a couple of questions about food sensitivities, and if that is playing a role potentially here in autoimmune illness and inflammation, how do you identify what foods, environmental issues, et cetera, a patient may be sensitive to?
Yeah, so if you see a naturopathic doctor, you can get definitely tested. So there's two different ones, the primary ones, there's other ones to look for, but the primary ones are something called IgE. So IgE is considered food allergy. So that would be like a peanut allergy, like anaphylaxis. And so they could do that through, any conventional doctor can just check for like IgE. And then they have something called IgG, which is called food sensitivity. And that's like a delayed reaction. So what that means is that you might have like eggs, for example, in the morning that you're sensitive to, but you don't necessarily react until the evening. So what happens is you're not really sure what food is bothering you and what it is and isn't. And so there's tests for what's called IgG, which are food sensitivity. So you can do that through some conventional labs, but then also a lot of, naturopathic physicians also work with specialty labs where you can get maybe like 50 tests run or 100 tests of different foods. I try not to do a huge panel of too many foods because sometimes people come back and, they're like, I have 200 foods I can't eat. So it could feel, again, really limiting. But you can do it through your provider initially to be able and actually talk to them about what's going on and why you want to actually check for it.
Well, Dr. Patterson, I so appreciate your time today. I know that we're just about out of time here. For those of you who have additional information or questions for Dr. Patterson, she did put up her contact information and her clinic's information. For those of you who have asked about, how do I address various different health concerns that you may have, there are a number of different ways of finding a naturopathic doctor near you. The American Association of Naturopathic Physicians has a Find an ND search tool, and then there are state associations in most of the states across the US for naturopathic doctors. So you can just do a quick Google search and find the state association for where you are living. If you're in Canada, the Canadian Association of Naturopathic Doctors also has a search tool. So there are so many options to find an ND. I know that many people here have asked, how do I get in touch with somebody near me? And so those would be the best ways to do so. So with that, Dr. Patterson, thank you so much for spending time with us today. I am so very appreciative of your wealth of knowledge, all the years that you bring to the table, and everything that you do for the profession, including the American Association of Naturopathic Physicians and the Black Naturopathic Doctors Association. I'm just so very thankful for everything that you've contributed to in the naturopathic profession. So thank you for joining us today.
Thank you so much for having me, Dr. Yanez. And only one thing, quick thing I forgot to answer, the author of the book, Your Body Speaks Your Mind. You just look it up, but I saw it did come up. I didn't have the name, but it's called Your Body Speaks Your Mind. So that's the only thing. Thank you again, everyone, for having me. Thank you for all the work you're doing to Dr. Yanez and to you all for being here. Feel free to connect with any other questions.
Have a great evening. Bye-bye.
Bye.